says U.S. schools are not doing enough to protect students from drinking water contaminated with lead. The report found, quote, a pattern of widespread contamination of drinking water at schools nationwide.
There is currently no federal rule requiring schools to test their drinking water for lead if they get their water from a public water system. Anna Werner shows us how one group is pushing schools and the federal government to take action.
Again?
In her Boston home, Julie Ma preps water bottles for her 5- and 6-year-old daughters to take to school the next day. Their elementary school's water fountains were turned off due to lead contamination.
We had gotten a letter from the superintendent saying that her school was one of the schools that tested above the 15 parts per billion, and that as a precaution they were turning off all water fountains, even though it was only one fountain that was tested.
That was 3 years ago. Since then, the district has brought in bottled water for students to drink.
It's concerning. I really would like to get the lead out of the water supply as fast as possible for the students. Many schools don't even know if they have it and haven't been able to make those changes.
She's right. A new review of school drinking water standards in 31 states and the District of Columbia finds regulations in most states are too weak to protect children from lead contamination in their school's water. John Rumpler co-authored the report.
Of the 32 states, including the District of Columbia that we surveyed, 22 of them are failing to protect their kids from lead in drinking water.
22.
Correct.
The problem? The group says it's the fixtures, fountains, faucets, and other parts that contain lead. The report cites an Ohio school drinking fountain that had more than 100 times the EPA's lead action level for tap water, an Illinois school at 212 times that level, and one drinking fountain at a Massachusetts school with nearly 1,500 times the lead action level. All of those have been replaced. But the group is pushing for all schools to simply get the lead out by replacing fixtures or, at a minimum, installing and maintaining filters on every faucet or fountain used for cooking and drinking.
Do you not think that some school districts are going to say, look, we're pressed for funds as it is? How are we going to do that?
First, not every solution is going to cost hundreds of thousands of dollars. So filters are, $100, $200. Some of them are even less. So that's a low-cost solution. But you're absolutely right. At the end of the day, not all communities are going to be able to tackle this problem on their own. And that's why we're excited to see states that are stepping up and showing leadership in helping communities invest in reducing this problem.
But Rumpler says the federal government needs to step up too, with more funding and a stricter standard for lead, since children's health experts agree that no amount of lead is safe for children. On Wednesday, EPA Administrator Andrew Wheeler told CBS News he plans to update drinking water regulations.
Regulation that hasn't been updated in over 20 years. And this is a proposal that we're going to be putting out this summer that I think is going to help a lot of areas make sure and ensure the public that they have safe drinking water.
So Anna joins us now. So Anna, the EPA has been pushing this proposal to have these regulations updated over the summer. But I can't help thinking, and you asked the question about it, about these schools that are falling apart already. I think about the Baltimore schools that had to close down because they couldn't heat the places properly. How are they going to afford to replace all of these faucets and the other things that need to be replaced?
So you heard one of the report co-authors, John Rumpler, there talking about the fact that, first of all, not all options are super expensive. If they add filters to water sources, that can be an inexpensive way to go about it. But even he will admit, yes, there are districts that are pressed for money, and that's why they are pushing for states to help out with funding and for the federal government to help out with funding, because there really is no safe level of lead exposure for children. It affects them at very low levels, according to the American Academy of Pediatrics. And so the risk is great.
Did John Rumpler, the co-author of that report, provide any examples of how the states can help each other find these solutions?
Well, for example, in Massachusetts, the governor there and the state have done some things to help with funding to provide more money to the schools. They've also, in some states, stepped up their regulatory efforts to give schools a bar to meet that is stricter. But they graded the states in this report. So they looked at 32 states. Why only 32? I asked him. He said because, frankly, some of the other states, they virtually couldn't find any policy on lead in school drinking water. Literally no policy at all. So they looked at 32 states that seemed to have at least some kind of policy. And what they found was, giving them letter grades, was that there were a few states that did very well. Number one state was Illinois. my home state. I don't know why this is. I asked him why was that, and he said because they had some legislation. People seem to be really interested in it, so they've done a really good job of looking at lead in school drinking water and trying to do something about it. D.C. has actually taken some steps. New York and California, right under that, with Oregon doing a decent job. But frankly, most of the states flunked because they have so little in the way of any regulation or testing or both.
How are parents reacting to this? I can imagine paying your taxes to send your child to school and finding out that they can't even drink water.
Right. The thing about this is I just wonder whether most parents assume that when they send their child to school, that water, the drinking water there in the fountains and whatnot, is tested for lead. I don't know for sure, but I suspect that for many parents, it's an assumption. You send your kids to the school, that's the first place that they would test for lead in the water, because exposing children to lead is a terrible thing that impacts them. We know this. We've known this for decades, right? This is not news. And yet, it turns out that if you want to find out, first of all, in most states, you're probably going to find that what they're doing is fairly minimal, if anything at all. And to find out the results, you're going to have to ask your school or your school district. So, there's no sort of centralized database where you can look up. And here's the other thing that gets complicated, okay? When you talk about testing, some of these schools only report if their testing is above what's called the federal lead action level, which is 15 parts per billion in the water. But the American Academy of Pediatrics will tell you that 15 is not safe for kids. It needs to be zero for kids, or as close to zero as you can get. So if they only report when a fountain tests, for example, above 15, then the reporting, the results are skewed to make you think there's no problem, when in fact they might have found 12 or 10. And from a health perspective, that's still a problem. So even when you get testing data, you're not necessarily getting the whole picture.
Yeah. Wow.
Really important reporting. Anna Werner, thank you so much.
You're
Appreciate
welcome.
it.